This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
Direct primary care is the freedom to practice medicine in line with your values. I'm Dr. Delicia Haynes of Family First Health Center, and this is my DPC story.
Dr. Delicia Haynes is the CEO and founder of Family First Health Center, an integrative membership-based family medicine clinic with a worldwide reach based in Daytona Beach, Florida. Through the direct primary care model, she empowers her patients to look and feel their best from the inside out with a lifestyle medicine approach. Her commitment to helping people understand that true medicine comes in more than pill form has enabled several of her patients to shed excess weight, safely stop medications, including insulin, become clinically non-diabetic, and live an energetic life they love. She enjoys serving a diverse patient base, including Olympic athletes, CEOs, best-selling authors, weekend warriors, top employees, teens, and domestic engineers. She compassionately helps them improve their physical and mental health so they can show up fully in their personal and professional lives. She is a diplomat of the American Board of Family Medicine, the American Board of Obesity Medicine, is highly trained in medical aesthetics, laser therapy, and lifestyle medicine. She completed her specialty training at the Halifax Center for Family and Sports Medicine residency program. Dr. Haynes attended medical school at the University of Kentucky College of Medicine and earned a Bachelor of Arts in Biology with a minor in Spanish from the University of Louisville. Dr. Haynes is also an award-winning coach and business mentor. She created DPC Prescriptions for Success, which helps doctors transition to direct care practices so they can express the art and heart of medicine while increasing their inspiration, income, and impact. Welcome to the podcast, Dr. Haynes.
Thank you. I'm so glad to be here.
It's such an honor. And I just want to put this out there for the listeners because it's such a special day that we're recording this on. And this is Dr. Haynes' mom's birthday. And so I just wanted to just say thank you to her for recording on such a special day. And we'll get into how DPC allowed her to be putting family first as we go into the interview. So thank you so much for joining us.
My pleasure.
So you had started your practice that was a fee-for-service practice in 2009. And then just 3 years later, in 2012, you were already listed in the Daytona Beach Influential Women's List business article, where you were quoted as saying, "If a hurdle is in your way, jump over it. And if you happen to fall, get back up." So having heard you in person, which I hope, and I can't wait for other people to hear you at this upcoming Hint Summit, as well as future conferences, from what you've shared, this has been true in so many ways in your life. And I wanted to ask if you can share for the listeners who may have not had the opportunity to hear you yet, What does that quote mean to you?
I think it's really all about your get back up muscle. All of us at some point are going to fall, and you start to trust your ability to fly when you know that, hey, if I fall, I can get back up. So that quote, it takes me back to some of my kind of darkest times. I am very open about back in high school, I was suicidal, went to medical school and became one of those wounded healers who found a career that would help them to take care of themselves, and suffered another episode of major depression to the point that I had to take time off from medical school, which was one of the most challenging decisions of my career, and also the absolute best decision that I ever made, and came back out from that, even though everyone thought that, I was done. I wasn't going to be able to return. And not only did I return, came and got all these awards at graduation, and then I started residency, which is actually where I did a grand rounds on depression and suicide amongst physicians, and got a little bit mad that I didn't know that we were the profession with the highest suicide rate before I started. I thought that was something we should have maybe talked about, but it wasn't until later that I actually felt that I was drawn to actually share my story when I became faculty at Florida State University College of Medicine, and they lost a medical student to suicide. And I just recognized that my silence wasn't saving anybody. And I didn't want to become known as the depressed doctor while I was trying to make a name for myself and build my practice. But when that happened, I also lost one of my best friends to suicide. It really just made me, there was the time where my love became greater than my fear. And I, even though I'm not the biggest extrovert, kind of started getting out of my own way, started to do some talks, wrote the book, and we'll get into how DPC is. None of that would have happened if I hadn't transitioned to DPC. So it's really all intertwined.
When you talk about how you were suicidal in high school, and then you add the expectations, the demands, the sleepless nights, the patriarchal society that we get in residency and medical school, what an environment to throw yourself into. And to have surpassed that, it's so great that you are here where you are today to be able to shine some light on mental health and the importance of mental health, especially for people who are going through that journey as well.
It's a calling. So it's definitely something I enjoy doing.
I remember the first step that we all went through, at least half of my class was on some kind of antidepressant, because the stress of, if I don't pass the step, what's going to happen to me? Like, I'm worthless. Why did I make this whole journey to go to a test that I might not be able to pass? It's just one huge expectation that we have to hurdle, as your quote says, and to support each other as we're on this journey is so important. And so if you haven't had the chance to read Dr. Delicia's book, The Dawn, please go ahead and check out her blog accompanying her interview so that you can read more about that journey that she is talking about now. And one of the things that you have created is a bracelet of empowerment. And can you tell us about what that bracelet is?
Yeah. So the wristband it says white coat safe space on one side, white coat brave space on the other, and then Yana, which stands for you are not alone. And I think so many times we as physicians, we don't know what to say when we see somebody else who's struggling. And so it came out of an idea of being able to just take this off, put it on someone's desk that's having a hard day with maybe a sticky note with your number on it, and just letting another doctor know that you care, that you're thinking about it, or a medical student. It came out of the book, just really trying to find ways to make people be visual supporters. Like, I am a white coat safe space. Like, you can come and talk to me. And so now it's the wristband and the lapel pin, and there's shirts and things of that nature. And we do an amazing book sponsorship program. And that's one of my main goals, is to make sure that every medical student understands their risk for depression before they enter. And so the book is being given away at white coat ceremonies across the nation. And first at Florida State, where I'm faculty, and where, unfortunately, that the young man who died by suicide was a second-year student, and his father wrote one of the forwards for them. And so it's just been a beautiful thing to really start people's medical career off with an acknowledgement of the risk factors. And also, most of the book is about what you can do to maintain and improve your own mental health and mental fitness.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. With you sharing about your journey, I want to touch on the fact that your dad was an Olympian. This recent Olympics, the example of Simone Biles, it shows us that in everyday culture, talking about depression is not always something that is welcomed. And so it's a good thing to think about as a DPC physician that you have the time, I'm sure, now to talk to your patients over weeks and months and years rather than the quick 15-minute visit that you might have had in fee-for-service.
Oh, absolutely. And I think in both the time that you have for your patients, because nobody comes in or very few people come in knowing that they're depressed. They come in and they've got the fatigue and they're not sleeping and all those things. And if it's a 7-minute appointment, which unfortunately is still like the national average, you just don't really get to dial in what's really going on underneath that. And so the beauty of DPC is that you really get to have that relationship-based medicine. And when I'm with my patients, the same way that I'll give them a blood glucose log or I'll give them something to check their blood pressure, I'll hand out a Bex depression inventory. And I just keep saying, if you're not measuring it, you can't manage it. We have time to measure it. And then on the physician side, because I became a DPC doc, that's when I actually had time to write the book. The knowledge was in for years. I had done the grand rounds, and how many of us as physicians have done so many grand rounds, and we have so many passion projects that we just don't have time to even give life to. And when I transitioned to direct primary care, I love practicing medicine in the way that I actually went to medical school to do it, but it also opened up that extra time to work with other physicians who wanted to do their own DPCs, and then also really follow my passion about mental health, particularly amongst physicians and health professionals.
As you talk about this journey in DPC and how you've had time to do passion projects and spend time championing mental health for physicians and your community, I want to go back because before you even opened your DPC, you had your own fee-for-service clinic. So I want to ask, when you graduated residency, what was going on in your mind and in your heart that led you to open a fee-for-service clinic on your own by yourself?
With the same passion that later led me to DPC, I didn't know about DPC in 2009 when I graduated from residency. All of my mentors were fee-for-service docs or they were employees. And so I started my own practice. I had a very strong passion or ideal of how I wanted to practice medicine based off of some really negative experiences that I'd had as a patient, and just really wanting to create to be the doctor that I wish I had, and then also create the environment that I would have liked to get care in. So because of that, I knew I couldn't just join someone else and say, can we change everything? And I'm also a interior designer. So like down to the paint on the walls, I had a vision. So I didn't know what I was getting myself into. And by the time I figured it out, it was too late. But I'm really glad that I did. The clinic I built from literally a sand floor, did the entire build out, designed every wall, there are certain things I designed really well. And then there was other things like storage that I completely missed the boat on. But it's just really nice to be able to design it from what I hoped it would be. And then as my practice grew and I realized that I started my own clinic so that I could practice medicine in line with my values. But because I was taking insurance, more and more of the decisions that should have been between me and my patient had to go through the insurance company. And my ability to negotiate, my ability to do a lot of things were really hindered. The paperwork was ridiculous. And I had to hire more staff to do more of the paperwork side than the clinical side.
And I just want to ask, because for people who, whether they're contemplating DPC or a fee-for-service practice, if they're thinking of jumping right out of residency, financially, how did you handle that situation? And
Yeah, absolutely. So I did urgent care, and I wouldn't recommend. So what I did, I worked my practice 4 days a week and urgent care 3 days a week, which obviously does not leave time for anything else. But I was coming right straight from residency. So I was just glad that I got to sleep in my own bed every night. So my standards were pretty low as far as lifestyle back then, not so much now. But I worked urgent care. I worked with hospice, just different ways to bring in income until my practice was able to be self-sustaining. So definitely when I asked some of my friends who had started their own practice, they all had spouses who were contributing, and I totally didn't bring that into the equation. I was asking them and I was like, how did you pay your mortgage? And they're like, oh, and I was like, oh, dang, didn't think about that. But it's doable, whether you are in a relationship or you're doing it like myself, doing it single. It's definitely doable. And if you know that it's what you're meant to do, it's really more just finding out like how you can make it happen.
yeah, definitely. Now, I want to touch on this idea of martyrdom, because you've mentioned this in a previous interview, but you talk about when your fee-for-service practice was self-sustaining, that you didn't have time for vacation, that you didn't have, time to take care of yourself. So I wanted to see if you can share with the listeners, like, what was that life like? And what point did you reach where you were like, this is not a sustainable model for me?
By day, I was the doctor. And then by night, I needed to be the business owner and make sure that all chasing claims and that sort of thing. I went through several different billing companies and billing individuals, and I knew it wasn't going to get better. Like I got better with increasing my own efficiency and that sort of thing, but the environment wasn't getting better. What happened in 2014, so I went to the National Direct Primary Care Summit in the summer of 2014, and you can never unlearn anything. So I had no intention of transitioning. I just knew I wanted to see some other options because I knew that what I was doing was not sustainable. I didn't have any time for myself. It wasn't definitely family first was just the name of the clinic. It wasn't how I was actually living. And that fall of 2014, my biller was poached by the hospital. They were taking over a lot of clinics. That's happening all over the country. They were buying up clinics and they needed billers. So they poached my biller. And the week before that, I got a envelope in the mail from the area's largest insurance company with a 40% cut to what the reimbursement rate was going to be. And it was really those two things happening in a fairly short period of time. And I was sitting at my clinic. It was like 10 o'clock at night. I was so hungry. All I had was ramen, and I had not had ramen since like undergrad. And I was like, how am I back here? This is not what we did all this work for. And that's when at the time I was battling depression at the time too. But even through that, I knew that what I was doing wasn't going to work. And that's when I started my transition.
And having been an entrepreneur already, and having, even though it was not sustainable for you, having a sustainable practice financially, when you went to that conference and heard what you can't unhear and learned what you can't unlearn, what was that transition like to DPC?
And I talk about this a lot when I'm on this stage, is that if you're suffering from depression, switching to DPC is not an antidote to that. Now, if it's burnout, where it's mostly work related, then obviously switching how you're working can really treat that. I recommend that if you are battling depression, that you actually get that treated. That is not what I did. I transitioned even though I was depressed, and I felt like I had to because of just kind of income pressures. And so I didn't have the fervor that most DPC doctors have when they're super excited, they're ready to go. I was still like beat down. And it wasn't until I actually, took the time to, have my depression treated. I had to, went to some retreats just to fuel my own soul. And that was when things really started to turn around, and I was able to exude the enthusiasm that it was always there, but it was just clouded by the mental health issues that I was having. So it can be done even if you are like in the throes of depression. But I think that you always want to put yourself in the best position, and then also you're just a more magnetic person when you're excited about it. And that's not the space that I was in. but I went ahead and, jumped anyway.
And having been through that transition and now it's 2021, do you check in with yourself to make sure that you are emotionally and mentally where you want to be?
I do. I have. So I talk about the Beck's depression inventory a lot because I take it every single Sunday. It's literally my like come to Jesus moment just to see where I am. And I have a score at which like, okay, it's time to start meds. No shame. This is just what it is. So it's part of my lifestyle and a big part of why I transitioned to direct primary care, because I knew what I needed to do to maintain my mental health, but I didn't have time to do it in my previous model. And I think that I'm very grateful to finding DPC for so many reasons, both for myself, for my family, and for my patients.
And when you talk about your family, I want to ask here, after you had transitioned over to DPC, that was when your mom took ill with cancer. So can you share about when you talk about this time that DPC allowed you, what was that journey like through your mom's illness and how did DPC enable you to be with her?
Mm-hmm. Yeah. And it happened even in 2017. I was in a car accident and had a traumatic brain injury. And interestingly, that was the first time that I spoke on the national DPC stage, and I had a concussion. So when I came back, I was off for 2 weeks, and in my fee-for-service clinic, that would have been, there's no income that would have come in. In my fee-for-service, I didn't take vacations because we didn't get paid. And I knew how much I was losing every second that I was on vacation because the bills didn't stop. And the beauty of in 2017, when I had the car accident, is that nothing changed as far as the income of the practice. I had some residents and some friends who were able to cover the clinic for me so that I could recover. I was still recovering when my mom was diagnosed. And one of my biggest regrets is that I didn't talk to her physician before he took her for surgery. He had said that, or she called me and told me that she had been diagnosed with uterine cancer and she was going for hysterectomy. And I assumed that it was localized and found out that it was not. They, rather than doing a CT or doing any imaging, they took her for surgery. And that's when they found out she was stage 4. I flew up it was really like the day after her surgery because I had an event the day of her surgery and she had said, don't come, you can just come later. And from that moment on, because I really didn't trust it, and she was at the University of Kentucky, which is where I went to school. And there's a lot of background there about people of color not getting the best care. And it was painful for so many different reasons. But I flew up and, met with her doctor, and he wasn't a bad person. He looked at her and she looked so good that it didn't cross his mind that it was not localized. And by then it was too late. She hadn't eaten for 7 days and then she needed to start chemo. And she had a lot of surgical complications that I knew that I could have prevented had I realized that they hadn't done any imaging. So from then on, I went into like mode of, I don't particularly trust the care that she's getting if I'm not there. She was very humble, so she would never tell anyone that I was a doctor. And so I was flying up every week, every 2 weeks to go to doctor's visits, to be there, running myself ragged because she is in Kentucky. I'm down here in Florida. And so although my personal life was mess, a complete mess, emotionally, I was so riddled with guilt. I didn't sleep for 2 months. But when you looked at my books, when you looked at the Family First Health Center books, you couldn't tell that any of that was going on. I was there that was at the fall of 2017. My mom died December 28th, 2018. And all along, I was, at her hospital bed. I was taking care of patients still from, the bedside. And was really, I had sleepovers in the hospital. And it was just, there was parts of it that was really beautiful that I put myself in a position where I could drop everything, fly up to Kentucky. I have a sleepover in the hospital, in her hospital room so that I could advocate and that I could take her to the bathroom, change the sheets, do all the things that needed to be done and just really be fully present with her. And so I was so grateful for DPC because of what it allowed me to be in terms of the daughter that I was able to be there in that time. It's something I wouldn't have been able to do with the ease that I did it had I still been in like the fee for service. And when it comes down to it, I think that's what it's really all about. Like at the end of the road, it's the relationships, it's the people that we love, and just being able to show up and be there. So to have created a business that allowed me to do that is completely priceless.
Yeah. It just makes you stop in your tracks when you really think about what matters at the end of the day. It's just wonderful that you were able to be with her. It kills me because having had the experience of my dad before he passed had atrocious medical care in the hospital. And when you as a physician know, like you could do better, I would never do that if it were my patient type of thoughts. That despite that, at the end of the day, you were able to be with your mom when she passed. So I want people to listen to those words, rewind, listen again. This is where when people talk about, oh, I can't do DPC because it won't make as much money. I got to keep doing fee for service. But why at the end of the day are we going to work at all? Yeah, we got to put food on the table, but at the end of the day, do we have time to take care of ourselves so we can take care of others? Do we have time to take care of ourselves so we can be with our families? So thank you for sharing.
Oh, absolutely. I literally crawled into bed with my mom on December 27th and had this thought that I needed to be there when she took her last breath, which she would have never wanted. And I just imagined that she was literally waiting for me to go to sleep. And then when I woke up, she was gone. But just being able to just do that, it was amazing. And also, like, again, on the business side, which is important, it's definitely not the number one thing. I've made more than I've ever made as a DPC doctor than I ever did fee for service. So I doubled the income that I had when I was fee for service now as a mature direct primary care. So there's definitely a growth curve. And so you'll have to do some augmentation of income as that's happening. The income is also there as well.
And when you mentioned that your practice right now in 2021, what's your patient panel and what's your patient mix like?
Yeah. So paying as agreed, which I always make a distinction between like total numbers of patients and who is paying as agreed, because there's the people who are supporting my practice. And then there are those others who I will at some point be acknowledging their decision to step away. So I want to say that right now it's like just under 600 who are paying as agreed. And then we have more that are in various states of either discharge or we're working with them. Obviously, with the pandemic, we're working with a lot of people who have lost income and that sort of thing. So we've got a lot of people that are on payment plans. And then in terms of insurance, the last time that we looked, it was 30% of our patients were uninsured. When I first started, that number was 40%. So it's definitely more women. When I look at my individual mix, when I look at the businesses that I take care of, it's mostly men. It's an interesting kind of transition there. And most of my patients are in their 50s, 60s. We've got a lot of 40-year-olds. I don't have as many kids, but a smattering of kids and families. So and then from a diversity standpoint, I attract minorities. I speak Spanglish. My patients think that I'm fluent. I don't claim to be, but so I have a lot of Spanish speaking patients. My MA is Mexican American, so she's better than me. But so we have a great mix in terms of like diversity as well.
And in terms of the staff at your clinic, it's you, your MA, and can you share who else is at your clinic?
So currently I have a full-time receptionist, a part-time MA, and like a VA, virtual MA, who used to be an MA here and moved to Texas. And I was smart enough to keep her because she's amazing. And we literally just had some staffing changes where I released someone to the workforce. But yeah, that's my current group.
And the woman who you had made a white coat with all of the colored handprints on it.
That actually is Dr. Alexis Avellino. At the time, she was my receptionist when I was transitioning to direct primary care. She was going to medical school. I, had her do all these projects, totally revamped her resume. She got into medical school. She is now a second-year ER doctor down in Miami, but we did her first white coat and we had patients and her family put their hands in paint and then we wrote messages on them. And then I put it on her as her first white coat. It was really touching.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited, customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. That's amazing. That's amazing. And I love to hear the update as to where she is in her ER career. That's wonderful. Earlier this year, Dr. Kristen Kim was part of your practice, and she has since moved on. So I want to ask, for those people who are considering partnering with a physician, employing a physician, or going through a transition where a physician is leaving the practice, can you share about your experience with Dr. Kim?
Yeah, and I think it's really good to have talks in the beginning of what it looks like if toward the end. And to that, so when Dr. Kim joined the practice, my mom was still alive, but was in the final stages. So I knew that I needed someone because I didn't know what that grief situation was going to be like, but I knew that I needed someone. I'm so grateful that my path and Dr. Kim's path crossed. She actually had lost a daughter in 2017. Actually, it was right after my car accident, because I remember meeting her with 2 twins on either hip and a 3-year-old by her side. And shortly thereafter, her 3-year-old passed away. So she wasn't practicing medicine for a while. And at the time that I was thinking I need to bring someone on, she was talking to her husband saying, I think I'm ready to go back, but I don't want to go back to what I, had done before. And some people connected us and we met for coffee. And she was very upfront about her desire to really just get back into clinical, working part-time, and that she really didn't see herself staying for more than 2 years. So I think that in the beginning, having those conversations about what's your goal? Fast forward. So she was with me she couldn't start in 2018 because she had a non-compete that we didn't know about, or she knew about, she didn't realize they were going to enforce it. So then I had to change her start date to 2019 so that she wouldn't get in trouble with her non-compete. And she was with us until May of 2021. And she had always wanted to do a practice, doing group visits. She's a very holistic, integrative style of medicine, which she was doing here. But like me, just having a really strong vision for how you wanted to practice medicine and knowing that you need to do it elsewhere. And she said, she was like, it's hard to leave a place that you're so happy, but there's a party that knows you're supposed to be doing something different. So I honor that as far as how we transitioned her. We let the patients know months in advance, like when she was going to be leaving. I throw parties for all sorts of reasons. So we had a going away party for her. She owns a farm, and I had these random chickens that started laying eggs in my yard. And so I incubated them and gave her literally hood chickens, because that's where I live, as her going away gift. And then her kid got Campylobacter. I know, but it's just really a beautiful, I think, crossing of paths. And there's every relationship has a season. You're going to have different staff that come and go, and being really upfront about what people are looking for and just honoring who they are and who you are, and that your season might be short or long. And so she's going to be starting her practice probably in a few weeks. She had some delays with construction and whatnot, and we're still very close. And I think I have a tendency to empower people. So I have a lot of people who have come and worked with me or been around me who've just gone on, not that I'm the secret sauce, but maybe, that have gone on to do these amazing things. And I actually take a lot of pride in that, whether it's me consulting with a physician, and simply by her being here in my practice, even though she didn't formally go through any of my coaching programs, we naturally were having conversations, or she was overhearing conversations that I was having, and being able to be around my staff. I think just recognizing that, be very upfront and be very clear about what you're looking for, And then touching base along the way of how things stand, what things are looking like. It was really hard for her when she told me that she knew that she needed to transition. And she gave me a year notice though. And so I think that says a lot about her and about our relationship. And I think that it's really possible to have that really fairly seamless of a transition. Most of her patients have been absorbed, into the practice, and they're, coming to see me now. Some of them will go and see her, and it's, really just a beautiful thing.
Awesome. And when you talk about empowerment and the seasons, I want to ask two big questions. One about coaching and what got you into coaching, but also about how you think about the seasons of a DPC physician in particular as they're transitioning from the early days to 2-3 years out to somebody like yourself, where you're definitely seasoned years beyond that. I know I'm totally stacking questions there. So let's start with what led you to even delve into coaching and develop the coaching strategies that you have today.
So people kept asking me, is the short answer. I hired my first coach in 2012 and have had a coach of some sort since then. Now, I was a Division I athlete back in the day. So I always had a coach who was somebody who could watch my form, look at my blind spots. And so I always knew the value of mentorship and coaching and consulting. But it wasn't until 2012 that I actually, started investing in it. And so I have numerous kind of coaching certifications that I got because I was going through it anyway, and it might as well just take the test and have the certificate. Even though I think we as doctors are addicted to certificates and papers and things of that nature. And then as my practice grew, one of my coaches, actually, someone else he was coaching with, let them know that I was giving all this amazing advice. And he was saying oh, you should develop a coaching program. Now, I'd already developed it. I already developed what I wish I'd had. I just never had actually marketed it or put anything out. And so he already had a few people who were interested in being in that kind of inaugural summer 2019 class. And it started off as a 6-week course, and then it became 9 weeks because toward the end, it was what was missing? What else would you like to know? And it's really nice to be able to just step by step walk people through, that process. You mentioned the seasons. And so the course is Direct Primary Care Prescription for Success. And it's really that first part is start with, why are you doing this? What do you want? Not what do you want your life to look like? Not just your direct primary care. And then everything else is a reverse engineering process so that you don't do what I did with my initial practice, my fee-for-service practice, which I built a practice that was great for my patients and terrible for me. And I built this prison, going back to the whole martyrdom thing. And we're so good at that. And especially in family medicine and primary care, we obviously didn't enter this because we wanted the highest paying specialty. We do have a tendency toward the martyrdom. So it's really important to help people. And especially when I'm talking to people about their pricing is, okay, so do you want to take a vacation? Because we need to add that in there. Are you living where you want to live or where you're settling to live? Because we need to add that in there. One of the courses that I'm teaching now, which is Direct Primary Care Prescription Optimization, which is for established DPC docs, a lot of that, everybody's getting their pricing changed or recommendations because we're oh, I can get by with this. And it's okay, you're going to work hard regardless. So let's not just get by. And then in particular for my physicians they have spouses, they're okay, our total household income is X. And so I just need to contribute Y. And I think because I come from this, obviously not having that extra income, and my belief system is your practice should be able to support everything. When we're talking about, pricing, when we're talking about packaging, there's ways that you can still take care of the people that you want to take care of and still make the profit that you desire to make. So making those. So there's a lot of different seasons in DPC, and I've been through a lot of them and seen a lot of them. And so that's what is nice to be able to talk to people about and talk to them about it as their situation, not just this random, you don't know anything about somebody and you're giving them random advice, but really, okay, the specific to your desire, your household, your goals, these are things that you may want to consider. So I've always been a mentor. I've always had a mentor. I was a consultant before I ever went into medicine. And so it's so many things, you end up bringing pieces of what you did before into what you're currently doing.
You had mentioned investment in your future, investment in your dreams and your goals. What do you say when people are asking, what does investment mean? I would love to hear from a coach, from a physician, from a seasoned doctor. What does that mean when you had approached investment in yourself, an investment in your first official coach in 2012 in the entrepreneurial physician space?
Some people will never get that, and that's okay. So I don't pretend, whether it's a patient or a client, I'm not for everybody. And I think it's important for all of us to recognize that. I think it's great to take advantage of all of the information that's out there, but just recognize the source. One of my frustrations when I started coaching, I waited until I had a very profitable practice. I didn't have to, but it was important to me to help someone get to where they would actually want to get to. And when I was talking to other doctors, and there's no kind of shade about doctors who are not profitable, and they can obviously give a lot of great advice as well, but I think that needs to be divulged. And I think that people just need to be like really transparent about that when you're talking to somebody else and they're making career decisions, family decisions off of your advice. So I take that very strongly. It's when I look at investment, I'm looking at shortening my learning curve. So, okay, I want to do it sooner, quicker, faster. I want to learn from your mistakes. I don't want to repeat them. I don't have time for that. I want to hit the ground running, and I want to build something that I actually want. That's where, if that matters to you, then that's when investment really makes sense.
And so for those interested in learning even more about Dr. Haynes's DPC Prescriptions for Success, please check out
dpcsuccess.com/schedule. And that's my scheduling page, so that we just, have a conversation to see if this is even a fit.
Now, I want to talk about your community and the fact that you're up to 600 patients. And I know you clarified who are the paying members and who are not. But one of the things that I loved is you had shared a story about going around to the local barbershops and teaching about hypertension and how to screen for hypertension. And I just love that you found a niche way of really communicating with your community and really helping them see that you are a physician who really truly cares about preventative health and longevity of a person's life. So can you talk about how that all happened and how you've continued to be a part of your community by throwing things like parties and whatnot?
Absolutely. And granted, that was pre-pandemic. Some of my community service had to change. We've done a school or a sports physical event every year. And during the pandemic, we just couldn't make that happen the way that we'd happened in the past. With that particular event, the Cutting High Blood Pressure was the name of the project. I had heard about it from another physician who, I think they did a TED Talk, and was like, I could totally do that. And one of my sorority sisters was like, have you seen this? And I was like, I could do that. And I went and bought a bunch of blood pressure cuffs and some rack cards that had what normal values were on one side, and then it had some information about our practice on the other side. And just went around to some of the barbershops and just said, hey, while people are waiting to get their, haircut, they could be checking their blood pressure. Are you okay with me showing you how it works so that you feel more empowered to show them? And it was some barbershops that collected dust. I won't say it was like a slam dunk everywhere. And then there were others that really depended on the barber or the stylist. So there were people who had their own health challenges. One lady who had a stroke before, and people literally will come there just to do that, not even to get their hair done. And so that really took off. And after we had that established, one of the larger hospital systems wanted to support it, and they were able to buy some more cuffs. Now they got wrist cuffs instead of arm cuffs, but we won't go there. But so it was just nice that it was something that I started and developed some wings. That was right before my car accident. And so when my car accident happened, a lot of my community service that required me to leave, I had to back away from some, but it is still ongoing at a few of those sites. And then since the pandemic, I've been doing a lot more mental health. Unfortunately, we had 2 of my patients who passed away from suicide. And in the direct primary care practice, because the relationships are so much tighter, it hits really hard. and just wanting to make sure that I was doing more as far as just people knowing signs and symptoms, people knowing how to get help. And luckily, that's something I can do virtually. So I've been doing a lot more kind of virtual community talks and introducing people to things like the Beck's Depression Inventory, just so that you have to ask yourself those questions that you don't sit down and ask yourself every day. And that's been really helpful.
And when you talk about community talks, do you have patients who are like, hey, my community is really asking about XYZ topic, and then that's how you find out what your community needs are? How do you craft your talks and how do you target who attends them?
It's multiple ways. And once you start doing speaking engagements, they're like dust bunnies. You just keep finding them. So with patients, when I'm in their social history section, we're going in because it's direct primary care. So we get to know all of what are your hobbies? What are you involved in? And that's when you really find out people's involvement in the community, what their interests are, what their passions are. And so there have been a couple of people that just by way of that, I've been able to say, oh, I have a straight talk that I give that's amazing and would, love to come and, do that for you guys. And I've done that talk for several businesses. And that was my entry into working with that business. That's one way. And then I've also, gone out to introduce myself to people that I would like to work with. 1 Million Cups, I love. I used to go every single Wednesday. And it was great to be around other entrepreneurs, especially like early stage entrepreneurs when I was in that stage as well. And we all were like marketing for each other. And I just love that kind of that ecosystem. It really goes to when you can clearly identify who you really like to serve, it becomes a lot easier to find out like where do they hang out? What organizations are they a part of? And then what do they need? What keeps them up at night? And what do I do that can help to, solve, or I can connect them with, because I'm not always the answer, but I can usually connect them with somebody in my network who is. And that's really helped me gain a lot of, and in terms of business patients, is that I connected somebody with someone and they remembered that. And anytime you do something for someone else, usually if they're a good person, they want to find a way to repay you, and that good stuff comes back.
Awesome. Now, recently you had posted about that you got Sculpt in your clinic. And so I wanted to ask about what are the fancy pieces of tech or things that you love about your clinic that helps you run on an everyday basis and allows you to practice the way you want to practice?
Yeah, introduce aesthetics into my practice back when I was fee for service. Then I was doing more things like Botox, Juvederm. Again, I was an interior designer. I care about how things look and symmetry and all of that. So I wouldn't say don't add it if it's not an interest of yours, but it was really in line with what I like, that health from the inside out approach and beauty from the inside out. And then when it comes to, I'm also board certified in obesity medicine and was always paying a lot of attention to people's body composition and making sure that we were finding ways to actually reduce fat and improve muscle. And currently, Sculpt's the only device that does both simultaneously. So when I saw it, I really wanted it for myself. And you have to be careful of that because sometimes those are not great investments. And I definitely wouldn't recommend an early stage DPC going out and getting these devices that are really expensive. Not when I did it, it's because I had runway to where I could handle that. So it's something that I'm excited to do. It fits really nice with my practice and my just health philosophy to be able to help people increase their muscle tone, decrease their fat, increase their core strength. A lot of these, especially my seniors, reducing their risk for falls because they're stronger and lengthening the amount of time that they're able to practice the activities that they really enjoy doing. So it just really was in line with, all of that. Plus I wanted it myself.
There's nothing wrong with that though, but I hear you if you're just figuring out the finances. So that totally makes sense. Now, what about on an everyday basis, your EMR, your software, what do you use that allows you to practice the way you want to practice?
Yeah, so I partnered with Hint early on. So I have been with them since 2015. And it's just nice because it allows that part to be a little bit more background and until somebody changes their credit card, and then we get that notification and it's like, okay, let's reach out and make sure that we update that. So it made running the practice so much easier compared to like fee for service. Like it's so simple. And so that's in the background. As far as EMRs, I didn't change my EMR. I had purchased an EMR way back when I first started in fee for service. It's a little bit clunky for DPC, but because I purchased it so long ago, it's a lot less expensive than what's currently out there. And it still has a lot of bells and whistles. I always pay attention to the tech for DPC because I may want to switch it someday. It might make sense. So it is an area that I'm always paying attention to. And like in the course, we go through all that. But for me personally, I have not changed my EMR just from a financial standpoint. It didn't make sense to.
With you having spoken about empowerment and with you being the featured speaker at this upcoming Hint Summit that's going to happen at the end of this week, I want to ask about empowering physicians, especially who are Black and brown, because physicians who are Black and brown are definitely a minority when it comes to physicians. So when you speak with someone who has come from a family that is Black and brown, how do you speak to them?
There are just certain universal experiences that you've had because of the skin that you're in or because of how you walk around in society. And so when it comes to patients or for like other physicians, but really for both, there have been experiences of me walking in to take care of a business. And there are some people there who didn't want me to be their doctor. And there are certain things that you can't change, nor would you want to change. And I really just getting to that point that I don't have anything to prove. So I don't have anything to prove, hide, protect, and being able to very quickly, if you're really sensing that you're just getting that just to shift and keep it moving, because there are so many people who are waiting for you. So don't get hung up on the people who are disrespectful or dismissive or any of those things. And then when they do come to you later, you can just say no. But yeah.
Yeah. And especially in the DPC space, because this idea of opening your own practice, and you did even before DPC, but the idea of valuing yourself, you're talking about the time to do things. One of the things we have time to do is really reflect on our own value and going back to why we're doing this. And this idea that if you are having those thoughts at all of trying to justify like what you're doing and whatnot, this is, if you open a DPC, that is your DPC and you get to call the shots.
And recognizing that really, like you are not for everybody. And in the beginning, I had this idea of if you have a pulse in a pocketbook, you are my person. And very quickly realized like, no, you're really not. And so the clearer you are on the people that you are really uniquely qualified to serve, then I think the happier your experience in DPC is, because you become really more magnetic to taking care of the people that like they've been looking for you and you enjoy taking care of them versus building your practice with a bunch of people who you really don't particularly, want to take care of or don't value what you're doing.
In terms of other resources that you found incredibly helpful along your journey, what are some that you found invaluable?
Really is hanging out with other business owners. Most doctors are not great business owners. And so I'm in this CEO exchange in town, which is basically, it's a group of CEOs that get together. And I am definitely the smallest in terms of the company. I came in as a speaker. And so this is to that. I came in, I gave my stress talk. And someone who was there was like, we don't know if you qualify, but if you do, would you be interested in joining us? And I was thinking to myself, I know I don't qualify, but yes. And then one by one, I've, started just serving companies around that table. So just networking with other entrepreneurs, I didn't come from an entrepreneurial family. So there were conversations that just weren't being had at my dinner table. And so to be around people who have built businesses, especially those who have created like businesses that have been like generational, has been just, amazing. And so they're doing things that, aren't medical, but that can very easily apply, or at least make you question why you're doing, what you're doing, or can you streamline anything? One of the CEOs in my group is Chick-fil-A franchisee. And, Chick-fil-A is just like efficiency out the wazoo. I learned so much by just being in the room. So anytime you have a chance to like be in the room, ask questions or just listen, that's really helpful. And then, so really a mentorship, I think from a lot of different angles is important, both in your, like the personal realm. I invest heavily in personal development because my business will never go any further than my own personal development and my own. So wanting to expand that and needing to expand that, really just looking for ways that you can improve all the different aspects of your life. And if you find somebody who is doing things that you want to do, or they have things that you want to have, they've got the relationships that you want to have, sit down and have coffee with them. And people love going for coffee and being interviewed. And that's usually how I end up working with most of the businesses that I have worked with. Is I'm inquisitive about their startup story, and it just goes from there. And it doesn't always, but it's always an interesting story. And I would think about, is there a way that I can support them and I can help them, or can I connect them with something that they can, if the answer is not me?
If someone is interested in reaching out after this podcast, what's the best way to contact you?
So they can email me at drdelicia@dpcsuccess.com. It's DRDELICIA at dpcsuccess.com. That's a really easy way to, get in contact with me. And whether it's direct primary care or the mental health piece, I speak at medical schools, and that is such a passion of mine. You can reach out there or across social media at Dr. Delicia MD.
Awesome. And for those who are holdouts and they're just on the fence about attending this year's Hint Summit, why should they attend Hint Summit this year?
I think that the Hint Summit always brings a lot of things in terms of technology, in addition to the kind of the stories. So you're going to get a lot of information about both. And I think there's been so many advances in technology, especially with the pandemic. We are actually fee-for-service doctors are doing telemedicine now, which wasn't the case back when I started my ATP. So just really staying abreast of, from a technology standpoint and just from what's out there and what people are doing standpoint, it's great. It's great networking, because you get to meet with other physicians from all over the country who are in this model, and you're able to ask them questions and just pick their brains. And then I'm excited to be talking as well. And we'll be really helping doctors craft their personal stories. I'm not sure if I was supposed to let that out, but which is so important in terms of developing a practice that is truly purpose-driven. So I think all those reasons and more are things to come to the Hint Summit for.
Wonderful. And if you haven't registered yet, summit.hint.com is where to find registration. So thank you so much, Dr. Haynes, for joining us today. We look forward to seeing you at Hint Summit.
Thank you.
Next week, look forward to hearing from Dr. Brian Blank of Ember Modern Medicine in Greenville, South Carolina. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, including DPC swag, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Conception.